adrenergic drugs. Okay, in this before starting the adrenergic drugs, we are going to start. We will study a little bit about the adrenergic transmission, how the adrenergic transmission takes place. Mainly the neurotransmitter which is used for the adrenergic transmission, that is noradrenaline. So we have to study how the synthesis of noradrenaline takes place. So the synthesis of noradrenaline takes place mainly from the phenylalanine. So phenylalanine is an amino acid which is converted into tyrosine in the liver. Okay. Then this tyrosine gets converted into levodopa by the enzyme tyrosine hydroxylase. And after that, this levodopa on this enzyme which acts as dopa decarboxylase, which converts it into the dopamine. Then this dopamine enters into the synaptic vesicles, the vesicles which are present in the presynaptic region. Okay. So this dopamine is then converted into noradrenaline by an enzyme which is called as beta hydroxylase. So these three enzymes, tyrosine hydroxylase, dopa decarboxylase, and beta hydroxylase, these can be inhibited by certain drugs. For example, this dopa decarboxylase is inhibited by metidosine. Same this dopa decarboxylase is inhibited by carbidopa and benzodiazepine. Same is the case with the tyrosine hydroxylase, it can be inhibited by the metidosine. Okay, and then this noradrenaline, the nerve impulse comes from when the nerve impulse transmits here. This noradrenaline is released from the presynaptic vesicles, they merge with the membrane and it's released. Okay. Then this can either act on the alpha receptors, either act on the beta receptors. So noradrenaline it will act either on the alpha receptors or on the beta receptors. So alpha receptors, that means it will show the alpha actions, on the beta receptors it will show the beta actions. So there can be different actions of the noradrenaline, either alpha actions or beta actions, adrenaline and noradrenaline. Now, after acting on this, there will be the reuptake of the noradrenaline back into the synaptic vesicles or presynaptic area. This reuptake takes through an transporter, which is also called as noradrenaline transporter. It takes place through this. Okay. So this reuptake is inhibited by two drugs. One is cocaine and second category of drugs, that is tricyclic antidepressants. So both cocaine and tricyclic antidepressants, they will prevent the reuptake of the noradrenaline into the presynaptic vesicles. Okay. So the first step, tyrosine, when it was converted into levodopa, that we call it as red limiting step. Okay. Then at the end, the metabolism of noradrenaline it takes place. It takes place by we have some COMT inhibitors also, catechol-O-methyltransferase. Okay. Now we have some functions of the adrenaline. This main drug here we are having is adrenaline. Okay. So there are some specific actions. First action is on the heart, so it will stimulate the heart. Okay. So it will cause the stimulation of the heart. The first thing, it will cause increase in the heart rate, which is called as positive chronotropic effect. Second thing which it will do to the heart is it will increase the force of contraction or force of contraction of heart. So it will increase the force of contraction of heart, which is called as positive inotropic effect. Third one is it will increase the SA, sinoatrial and atrioventricular node conduction, which is called as positive dromotropic effect. So positive inotropic, positive chronotropic and positive dromotropic effect. These are all the effects of the adrenaline on the heart. Next is it will increase the cardiac output. Okay. So cardiac output, the amount of blood is pumped by the heart, that will be increased. Plus it will also increase the oxygen consumption of the heart. Oxygen consumption plus cardiac output both will be increased. So that is the effect of the adrenaline on the heart. Second effect is on the blood vessels. So on the blood vessels it can cause both the effects, either vasoconstriction or vasodilation. So either it will constrict the normal blood vessel or it can dilate the normal blood vessel. So it will cause either vasoconstriction when it acts on the alpha and alpha 2 receptors, and those are present in the skin, mucous membrane and renal system. Whereas vasodilation it will cause by the action on beta 2 receptor, which is mainly present in the liver. Okay. So on respiratory system it will cause bronchodilation, it will dilate the bronchi, because of that the respiratory rate will increase. Fourth is it will cause contraction of vas deferens, male sexual, which is present in the male sexual reproductive system. So it will cause the contraction of the vas deferens plus seminal vesicles by acting on the alpha 1 receptor. Because of that, there will be impaired ejaculation and it can also cause impotency. Okay, so adrenaline can also cause impotency by this mechanism. Next one is lipolysis. So adrenaline or acting when it acts on the beta 3 receptors. For example, this is the adrenaline, it acts on the beta 3 receptor, it will cause lipolysis, means breakdown of the lipids. Okay, that's one more action. So one more thing which is important here, that is beta 2 receptor agonists. All the beta 2 receptor agonists, they are anabolic in nature. They are anabolic in nature, that's why they are being misused by the sports person. So this question will sometimes be asked in the examination. So all beta 2 receptor agonists, they are anabolic in nature. Okay. So at last, there are some important uses of the adrenaline. We can remember these uses by A, B, C, D, E and G. A means they are used in case of the epinephrine shock. B, they can be used in case of the bronchial asthma. Why in the bronchial asthma? Because this adrenaline, it causes, we have written here, on respiratory system it causes bronchodilation. So bronchodilation, we have stated here that the adrenaline is used to treat the bronchial asthma. Okay, in what happens in the bronchial asthma? There is the narrowing of the bronchi. Okay, so when you will give the adrenaline or adrenergic drugs, they will cause relaxation of the bronchi. That's why they are used for the treatment of the bronchial asthma. Second and third, they can be used for cardiac resuscitation. Then D means duration of anesthesia. They will increase the duration of the anesthesia. E means epistaxis. They will control the epistaxis, means they will control the nosebleed. Okay. And G at the end means glaucoma. They are also used for the treatment of the glaucoma, either narrow